Dementia Prevention. What do you actually need to know about it? I'm Dr. Leah Croll, a board-certified neurologist and lifestyle medicine specialist, and I want to cut through the noise and just tell you what actually matters in this space because there are so many health and wellness influencers out there and supplement brands that are capitalizing on the very common fear of developing dementia. And of course, that fear is totally understandable, but the good news is there's so much within your power to protect your brain health and your memory as you get older. So let me start by saying that at least 45% of dementia cases are preventable, and it's never too early or too late to start making healthy changes for your brain. So if you're watching this, I'm so glad you're here. I don't care how old you are, how young you are. There's a lot we're going to get into that you can do to have a meaningful impact on your long-term brain and cognitive health. So what the evidence tells us in terms of staying sharp as we get older is that the key is to focus on multiple domains of health and wellness. So diet, exercise, sleep, cognitive stimulation, social engagement, your overall medical health, all of these things come together, converge to inform your brain and cognitive health. So what really is the bottom line here is that brain health is less about one magic bullet or supplement and more about cultivating consistent, healthy habits over time. Now, the first domain that I want to focus on is exercise because of all the lifestyle interventions for healthy brain aging. This is the one that far and away has the most scientific evidence behind it. Movement is absolutely medicine for the brain. And when I talk about movement, I mean both cardio and resistance training. Now, there's a reason why so many studies tell us that people who are relatively more active have lower risk for dementia and cognitive decline, and the opposite is true for people who are relatively less active. So what I recommend to my patients is to aim for 150 minutes per week of moderate intensity cardio. That's something like brisk walking, plus at least 2 sessions per week of strength training. Now, that may not be attainable for everyone. People have time limitations, physical limitations, and that's okay because what the evidence tells us is that doing a little bit of exercise is still meaningful and certainly much better than doing no exercise. So again, it's about consistent, healthy habits as opposed to being perfect or looking for that magic bullet. If you want bonus points or extra credit when it comes to exercise, activities that combine movement and coordination really pack an extra bang for your buck in terms of brain health. So things like dancing, pickleball, tennis are really wonderful for your brain. Nutrition is a powerhouse for brain health. The brain is the most metabolically active organ in the body. And so, of course, nutrition is going to make all the difference. Study after study tells us that Mediterranean-style diets are the way to go when it comes to keeping sharp and supporting your memory. Now, that means emphasizing things like fruits and vegetables, leafy greens and berries are particularly good for brain health. Also emphasizing lean proteins like fish and poultry, healthy fats like olive oil, nuts, fatty fish, whole grains, beans, minimally processed foods, and staying away from highly processed foods, unhealthy saturated fats like red meat, butter, cheese, and any foods with excess added sugars. Sleep is one of the most underrated pillars of brain health. Most of us conceive of sleep as downtime, but it's actually a period of active maintenance for the brain. This is when the brain regulates emotions, consolidates memories, and cleans itself out. And it turns out that cleaning process is really critical for preventing some of the neurodegenerative changes that we see with things like Alzheimer's or Parkinson's disease. So really important to prioritize your sleep, be consistent with your sleep schedule, get 7 to 8 hours a night if you can. And if there's something that's interfering with the quality of your sleep, like sleep apnea, for example, you definitely want to address that. Social engagement is another overlooked piece of this puzzle very commonly, but we know without a doubt that isolation and loneliness definitely are linked to an increased risk for dementia and cognitive decline. So as you get older, you really want to give your brain workouts by navigating the complexities of relationships and having meaningful conversations. That means maintaining close relationships with your friends and family as you get older, but also forming new social engagements, whether that's through a group fitness class or community activities. All of that is so good for you. Cognitive stimulation is something you want to be intentional about as you get older because the brain really thrives on novelty and challenge. Simply put, if you don't use it, you may lose it. Now, I see plenty of apps going viral for this. I see a lot of health and wellness influencers doing fancy finger exercises for this, and all of that is great if it works for you, but you absolutely don't need any one activity or anything fancy. What works is cognitive stimulation that fits into your life and is enjoyable for you. So that could be as big as learning a new language or as small as trying a new recipe when you cook dinner tonight. Some people really enjoy reading or writing. Others may like puzzles, crosswords, card games. Whatever works for you is the right answer here. And maintaining your overall medical health is another huge piece of this puzzle. Now, this could be a whole separate video. There's so much that goes into the connection between brain and body, but I want to highlight a few key points when it comes to dementia prevention. The first is addressing hearing loss early. So I talk about this with my patients every single day. It is not fun to experience hearing loss. It is not fun to go out and find hearing aids. I understand that. But unfortunately, hearing loss is one of the most dramatic risk factors for developing dementia. So it is worth your while to intervene early. The same can be said for vision changes as we get older. Vaccines and dementia risk are a hot area of research. I have a whole other video on this if you're interested in learning more. But the bottom line is that the research tells us that many vaccines, particularly the shingles vaccine and the flu vaccine, are really important for reducing your risk for dementia. So work with your doctor to stay on top of your vaccine schedule. Cardiovascular health, another big one here. The brain and the heart are so profoundly interconnected, and what's good for one is often good for the other. So staying on top of high blood pressure, high cholesterol, diabetes, these things are so important for your cognitive functioning, and they will pay dividends for your brain health down the line. And finally, avoiding harmful substances. If you are a smoker, the best thing you can do for your brain health is to quit. And all of us can stand to be reminded that heavy alcohol use really takes a toll on the brain, particularly over time. So you don't want to stress the brain out. You don't want to burden it. You want to set it up for success, and that means moderating your alcohol use. If any of this was interesting or helpful to you, please let me know in the comments. I'm happy to do further videos that dive deeper, that break down the data, if that could be useful for you. Whatever you want to know about your brain health and your dementia risk, I want to help. Thank you so much for watching.